In terms of the fillers, where can you use those on the face?
So with fillers, it's essentially, people don't know what it looks like. So whereas Botox is a liquid, looks like water, we mix it up, comes as a powder, and then we inject it in with a very fine needle, very specifically over the face. It then works on the muscles. The way fillers work is they're a clear gel-like substance, and they come in varying sizes of thickness within the syringe, and you use that on different areas. So for example, a filler in the lips is essentially going to, you could either, as if it's an older person who wants to restore that volume that they lost in their lips, or people that have smokers' lines or oral sort of aging signs.
You just subtly.
You smooth it out with a very fine, thin filler, and they get essentially what they've lost with aging. So you're replacing the hyaluronic acid that we have in our skin naturally, but they've lost that with aging. Whereas in younger girls, essentially putting lip fillers in, you're giving them what they weren't born with. So the areas of
shooting.
Yeah,
in a fun way. Everyone needs it to a little bit of.
So it's amazing. A lot of people think lip fillers just to make the lips look bigger, but we always think it's very much to shape them and to define them. Yeah. So you want to have beautiful looking lips, not just bigger lips.
Yeah, it's more of an art than it is.
Yeah, and I suppose sometimes lips can be a little bit unbalanced and things
like
that, like fuller
you can
bottom lip, but then feel like they lose it on the top. How long does that last?
So depends on the density of the filler, and then also, for example, your sort of typical habits. So if you use a sunbed, you're going to wear down the filler quicker.
Oh really?
Yeah. Okay. So generally heat breaks down fillers, and things like sunbeds, people that go to sauna and steam room very often, they're going to break down the filler quicker, but generally lip fillers last up to 6 months. Other fillers, so for example filler in the marionette lines, or the nasal labels and the marionette lines, that sort of filler is a bit of a thicker filler than the lip fillers. It lasts up to a year. But things like cheek fillers, which are very, very dense, we want them to mimic bone almost. So they're very thick fillers. They last up to 18 months, so a very, very long time.
Just sculpt people's face.
Exactly, and that's how they live for a long, long time. So it's really, really.
That's really exciting.
It's very much so. I always find Botox is rejuvenating. You're making someone look fresher and younger. Fillers are going to make them look very much transformed. So you're turning back the hands of time, or you're giving them contours, cheeks, lips that they didn't have, that they weren't born with.
And the results are instant, so you see them then and there. And both things are also reversible as well. That's another question we get asked a lot as well. So if it goes wrong, what can you do? So you can reverse.
Whereas with surgery, for example,
if you're chopping up your face.
It's very much you're committing a lot, isn't it?
Yeah.
Financially, surgery costs more, and also you're going through a longer procedure. You have to take time off work. You have to go through painkillers. Complications are more, whereas with these treatments you're very much, it's 10-15 minutes. I mean, the most complex procedure, the most invasive procedure is cheek fillers, which is where the needle goes the deepest. It goes down to the bone, but even that only takes 15 minutes.
15 minutes.
And then how long would they sort
There's
of
no real downtime at all.
Oh, is there not?
No, at all. No.
And you don't get, what about bruising? Depends on the person, I suppose.
It does depend on the person, if they're under the medications or things, but generally lips are the most likely to bruise because they're the most vascular, and we very rarely have seen a bruised lip. Very, very rarely. And even if it is, there's nothing you can't hide with a bit of lipstick.
Makeup. So even with like cheek fillers, for example, today we've done someone during their lunch break, and she's just put some.
No problem.
Literally no bruising. She's got a party tomorrow.
Wow.
Makeup.
She had a Botox as well. Obviously, Botox won't be working for the party tomorrow. But by Christmas it will be. So,
she'll go back after a lunch break and they'll be like, where have you been? I want to go there. I know that you don't just do these specific ones, you do quite advanced fillers and things. Can you tell me about your other procedures?
Sure, do you want to talk through that?
Yeah, so we can do fillers in other areas, so not just the lips. It's commonly known for the lips, but you can do things like jawline sculpting. So you can like inject some filler into the jaw, which just enhances the jaw. You can also, so we've talked about cheeks as well, so you can put filler in the cheeks, and you can do it in ways so you can either get like the contoured look, or you can just go for like replacing the fat pad, the malafat pad here, so you can just put some filler in here. So it depends what look you're going for. And then more advanced procedures of filler are things like doing a rhinoplasty. That's with a filler, so it's non-surgical, but you're just inserting filler just to even out the nose and give it a bit of a tip lift. You can do things like that, very subtle again. And also you can do like tear trough treatment, which is
that one sounds really good.
That one's actually amazing. It just what it does, it's for dark circles, and it's to reduce things like hollowness, which causes shadowing of the eye, which can make them look more darker than they are.
Yes.
And it's using like a lower density filler, and it's just about injecting it just under the eye. But we go in with a micro cannula, and I think you're probably better to speak about it because he does that procedure a bit more.
Yeah, so obviously with the eye, the last thing you want to do is to damage the areas around the eye, so the vision, that you don't want it to disturb vision at all. So you want to avoid using sharp needles, things that can puncture vessels and cause problems. So the best thing to use is a blunt tipped cannula, what we use. So it's a very fine, it's not sharp at the end, it then doesn't puncture anything that it's going through. It just moves things along, so it glides through the skin. So the actual entry point, which people think is like, if you're feeling here, they find it quite surprising that you're going in near the cheek. So we go in from the cheek and it glides the cannula into that groove, and that deep groove under the eye, what makes you look quite tired almost, isn't it? You're having a good night's sleep for a long time. Yeah. That's very much actually, people always think, if I have a good night's sleep I can get that to come back. It's generally very difficult. It's because
I've had it all my life. Even when I was a kid, I had that natural sort of groove under my eye.
It comes from the orbital fat pad, which surrounds the eye, thinning down over time, and then that creates quite a deep hollow under the eye. Yes. Which makes you look tired. The shadowing from the way the light hits it makes it look dark. Yeah. People trying to hide it with makeup or foundation, but it's very difficult. It's always the area
that I struggle with the most, I suppose, because some people do get that really darkness, but if you try and overload with concealer, it can all crease up, can't it?
Yeah, it does.
And there's nothing you can do about it. You can't just pack it in and just completely smooth over that area. So I think that is one of the areas that you can't cheat that much with makeup.
That's it. Whereas when you fill that area, so you're filling that. So the area is called the SOOF, the orbicular oculi orbital fat pad. So you're filling that with a hyaluronic acid filler, which will last up to 6 to 8 months. Okay. It mimics the skin around it, so it's a softer filler, so it moves with expression. You can't really tell it's there. It doesn't really feel lumpy or anything at all. It's very soft, and it just literally flattens that deeper hollowness, and it makes it the similar.
And I suppose that's
like surrounding tissue. It does, yeah. So because the filler is hydrophilic, draws water towards it. Yeah. All the rest of the area around that becomes very much sort of, I wouldn't say puffy, because you hear about some people saying but they get very much sort of softening of the fine lines that they're getting around their eyes. So,
that one sounds amazing.
Yeah, we do like an eye rejuvenation package. So someone's looking at tear trough, they'll benefit from like crow's feet and a bit of like brow Botox, like the lift as well, and that
so
just
lift the eyebrows, open up the eyes, soften the hollowness, soften the fine lines, and all of a sudden you've got someone who, their eyes just look really good.
They look less tired, they look youthful, and it just looks
That's amazing. The main place that people look at, isn't it? When you talk to someone, it's their eyes, isn't it? So I think that sounds like a good package.
It is very nice,
But if someone is a little bit averse to pain, do you have, what would you say to them if they're a bit scared about any procedures?
So a lot of our clients have had other treatments done, such as waxing or tattoos, or they've had other things done, and they worry more about coming and getting Botox or lip fillers than they have those procedures. So Botox, I would say, I've had it done myself, it is very minimally painful at all. It's very, very fine. Needle that we don't have to use any numbing cream because it's just not worth it. It's just almost not painful. It's a very fine scratch you feel, and it's over before you know it. And it just literally takes seconds to do. So minimal to no pain at all, minimal to no downtime. Fillers, so usually people have heard about lip fillers being a bit sore. It is a bit sore because the lips have got lots of nerve endings there. You're very much, it's a tight compartment, so you're stretching the nerves, you're stretching the compartment. So we have to put numbing cream on, so we numb the lips up with a numbing cream. We give them a good 20 minutes before we start injecting, so the lips are feeling very much numb. It's almost like, when you go to the dentist and have a filling or something, and your whole mouth just feels, you can't feel anything, you don't know if you're dribbling, you can't speak properly, your lips just go completely numb. So it makes the injection process very much comfortable. The fillers we use contain local anaesthetic, so they numb up as they go along. Would they expect like just a little bit of pain kind of after the treatment? After the treatment there's almost none, because the local anaesthetic in the filler means their lips are completely numb. That's good. Everywhere we've injected is all numb. It's only very much the first few injections that can be a bit uncomfortable. They feel a bit sort of stingy almost, is how I describe it.
Yeah.
So the needle going in isn't usually quite sore at all because of the local anaesthetic cream. But when we inject the filler and it stretches the nerves, that can be a bit of a bit uncomfortable.
Yeah.
But most people just don't really flinch, or they don't.
No,
really
they don't. Yeah, they just describe it more as like, for example, cheek fillers. They describe it more as like a weird sensation.
Yeah.
Not very comfortable, but not painful at the same time. Just a weird sensation, really.
Oh, that's really good.
Yeah. So, yeah, it's not sore at all.
Yeah.
And even, for example, going around the eyes, we always think, you know, that's going to be very sore with a micro cannula, but because it's blunt and it's gliding through tissues, it's not actually cutting anything.
Oh.
You're not actually. It's not very particularly sore at all. You might get some sort of. You feel almost sort of tightness or stretching around the eye, but nothing sore.
But nothing otherwise.
Oh, good to know.